Good afternoon. My name is Patricia Banks, and I am the Regional Program Coordinator of NAMI New Jersey en Español. Welcome to our multicultural webinar, Crossing Borders, Bridging Minds, exploring the intersection of immigration and mental health. Before we begin, we will ask you 2 questions to understand a little bit about you. The first poll question is, which best describes you? You have immigrated to the US, you have immigrated sometime in your lifetime, or you are here as an ally to support. The second question is, what are you looking forward to most about this session? Number 1, to learn about the immigrant experience, learn about coping tools, or how to be a better ally or supporter to the immigrant populations. Thank you all for participating in the poll questions. NAMI New Jersey is committed to serving New Jersey's most diverse communities. We represent the interests of all people affected by mental health conditions, regardless of their age, gender, race, ethnicity, national origin, religion, ability, language, socioeconomic status, sexual orientation, or gender identity. With these conversations, we aim to bring more awareness to the relationship between mental health and culture. This webinar will dive into the complex relationships between immigration and mental health, exploring the multifaceted challenges faced by immigrants as they navigate new cultural spaces. Understanding the intersection of immigration and mental health is crucial as individuals and families cross borders in search for better opportunities. They face significant mental health issues from cultural adjustment, language barriers, and the emotional toll of leaving loved ones behind. Today, licensed psychotherapist Dr. Christine Coleman will provide insights into the psychological impacts of migration, including the stress, trauma, identity crisis, and cultural adaptation. Today's session will highlight the importance of culturally sensitive support systems and accessible mental health services. By recognizing these challenges and promoting community-based resources, we can support immigrants navigate their new environments with resilience and strength. I am glad to be here with you all to learn about this topic. Now, I am honored to introduce our amazing guest speaker, Dr. Christine Coleman. She is the founder and CEO of POC Thriving, a private practice specializing in the intersection of mental health and diversity, equity, and inclusion. With over 15 years of clinical training, she focuses on the psychological and emotional well-being of BIPOC, Black, Indigenous, people of color professionals. Dr. Coleman also supports companies with mental health, inclusivity, and their belonging initiatives, having trained leading organizations like Pinterest, Business Wire, Coursera, and the MLB Network. An internationally recognized speaker, Dr. Coleman has presented at Yale's Mental Health Conference, UC Berkeley's Women of Color Conference, and the American College Health Association. She has also been featured in the Harvard Business Review, Fast Company, Vogue, MSN, and the Huffington Post. Isn't she great? Dr. Coleman is the founder and executive director of Soul Sisters Incorporated, a nonprofit dedicated to helping women overcome their societal barriers. She also leads the Women of Color Thriving Collective, a dynamic network designed to support and elevate women of color in leadership roles. She holds a BS in psychology, a master's in counseling and psychology, and a PhD in marriage and family therapy. If you'd like to hear more about Dr. Christine Coleman's story, we will drop the link in the chat to her website. Dr. Coleman, thank you for being here today. The audience is now yours.
Thank you. Thank you so much, Patricia. Hello, everybody. Good morning where I am on the West Coast. Good afternoon, I believe, to where you are. And if anybody else is in a different time zone, hello, and thank you for having me today. Thank you so much again for that warm welcome. Today's topic is honestly very, very near and dear to me. It was definitely a labor of love putting together for you all, because I deeply care about serving immigrant communities. And I loved seeing the insights already about who's here in this space through the polls. I see some of them still coming through. Please fill that out. It helps me and us know who's in this space. because there's a diverse group of people here, I've prepared this presentation to hopefully speak to you all in different ways. And now we have 1 hour to get through a lot of information. So I will do my best to ensure that I'm speaking to the varieties of people here. And we also understand that by no means can we cover every single thing that is so important in this topic. So please know that this is a great honor for me to be here and present to you all today in this space. So again, thank you for that wonderful introduction. I will not take any more time to give you any more of this, but this is that in summary. And really what I want to highlight on this slide is just my greatest mission, and that's to create equitable mental health opportunities across communities and organizations. So this topic and this time together here with NAMI really speaks to, again, my personal mission. And I just thank you again so much for having me here. We are in webinar format, but I also know that there's ability to engage, and I don't want this conversation to be boring or me talking at you. So I will do my best to engage with you all in the chat box. I will do my best to refer to the chat as we go forward. And I also know that I have a lot of information to cover today. With that said, ultimately, we are here in community, right? Comunidad. And it's essential for us to know that we came here to learn, we came here to be, and many of you also came here to be supported, seen, and held. And so community above all else, especially as we talk about really important topics like immigration, we need each other. We need each other if we're allies. We need each other if we identify as immigrants. We need each other just as a whole, as a community of human beings. So with that said, in order for us to establish some psychological and emotional safety, I ask that, if somebody decides in the chat box to share something personal about their life stories or something that you might be thinking about a client, please do your best to uphold what is confidential, whether you share confidential information or, of course, if you receive confidential information, please do not share it outside of this space. With that said, as I said, this is a space for us to just be together, come in our whole human selves. So come show up authentically today. If you have something to share that is out of love or courage, we want to hear from you. Ultimately, this is an emotionally safe space, or designed to be. So help us create that and maintain that today. And I'll ask that we all respect each other and our opinions. So again, this is an educational space. I am a therapist, but this is not a time for therapy or to be judgmental or to get into combative situations in the chat together. This is meant to be inclusive, safe, and supportive, and of course, to provide you some information on this topic today. If y'all can agree to this, can you drop a 1 in the chat box? I'd love to see those ones slide through here just so we can all be in agreement of what the tone of this space is today. I see your ones coming through. Thank you so much. Yes, keep those coming, everybody. And as you drop those ones in, I'm going to just invite a deep cleansing breath for you all, for us all. It has been a week. It's Friday. This topic could also bring up some emotion for you. Again, whether you're here as an ally, whether you're here as a loved one of an immigrant, whether you yourself can identify with the immigrant experience. So let's go ahead and get into it, but I ask you to take good care of yourselves in this space too. This can bring up some things for some folks. So take the information as you will and take good care of yourselves in the process. For this time together, we are going to first explore the psychological impacts of migration. We will also examine the culturally sensitive support systems and the different approaches that can come with that. I hope that we can walk away determining effective advocacy techniques and interventions for serving Latinx as well as all immigrant communities. I know that Latinx are not the only communities here that we'll talk about. And then also my hope is that you all walk away with some more strategies for building supportive communities and effective mental health interventions as well. To ground us as we get started for today, I thought it would be important for us to differentiate some terms when we talk about immigration. Immigration can mean a lot of different things, and we sometimes hear other terms used interchangeably. So for the sake of grounding us in the education and also to define some terms that I'll be using today, I wanted to give us some context. So first, by definition, immigrant is a person who comes to live permanently in a foreign country. But a migrant is someone who has moved or is moving away from their usual place of residence, regardless of the following factors. So that can be determined by legal status, whether the move was voluntary or involuntary, the reasons for the move, and the length of stay. So we kind of see some difference here in immigrant versus with permanency. Again, does permanency mean forever? Not necessarily, but a migrant might be someone who, again, for different reasons has moved or is in the process of continuing to move. A refugee is someone who has been forced to flee their home country due to persecution, war, violence, or other circumstances that make them unable to return home safely. Refugees are protected by the international law, including the 1951 United Nations Refugee Convention. Asylum seekers, we hear this term used often in the news, in the media, but we also know that this has been an effort and an opportunity for some people and not an opportunity for others. So essentially, asylum seekers differ from refugees because they arrive to their destination without pre-authorization, and they're yet seeking asylum, or again, that protection, the essentially the protection that maybe refugees might have, or some solace, some opportunities of safety and opportunity to just again have some dignity and protection through the country or region that they're entering from the persecution that they might be fleeing from. So again, for the sake of today, I will likely be using the term immigrant for the most part, but we also know that that does not mean that we are going to erase the other experiences of people, again, in this space or those that are not in this space or that we serve, okay? I hope that's helpful. As I mentioned again, we also sometimes think of immigrants and default to certain demographics that we have in mind. And what I also wanted to uplift in this space is that immigrants come with a great diversity amongst themselves. We immigrate from all different parts of the world to specific regions, countries, etc. Another defining or grounding moment for us today is to consider that I will be talking mostly about the immigrant experience to the United States, but we know that people immigrate to all types of different places outside of the United States too. So with that said, we are diverse amongst language, our social resilience, right? The ways in which we adapt and the ways that we handle the social factors that can affect us or affect immigrants in their experiences, diverse in their occupations, diverse in socioeconomic status, and also the generational status. So we often hear about first generation, second generation, third, and so forth. That can also impact, again, the overall experience with mental health, etc. We are also diverse in culture. We're diverse in religion and also diverse in race and ethnicity. I think that might be a given for us, but we want to make sure we define that as well. So we are, again, grounding ourselves in understanding who we're talking about, honoring the people in this space, and honoring that diversity within this great term of immigrants or immigration. So I saw your poll answers come through. Maybe I missed some as folks started to settle in this space. Again, welcome. I'm curious, for those who identify as immigrants or who have experienced immigration in your lifetime, where would you identify how would you identify yourselves in this diversity? Is there anything that comes to mind that you want us to know? And perhaps if you're here as an ally who is here to support or who serves with immigrant communities, which of those communities do you identify with? Where are the people typically from? So if you'd like to share with us in the chat box where you originate from and where you have immigrated from, please do. If you'd like to share some of the communities that you serve as an ally, please do as well. And I will continue moving forward, but I am going to just check the chat box really quickly here. All right, I see Colombia, Puerto Rico, India, El Salvador, Barbados. You came to the US at 17. Wow, what an experience. Ooh, yes, thank you for also giving that context there too. Brazil, India came at 10. Wow, so many of you came at a young age. Dominican Republic. Anything else? Anyone else? Okay, thank you for sharing that. China, age 5. Yes. So again, we are offering you a lot of love and tenderness and also extending that to those who are not in this space. And where a lot of you are recalling right now the experience as children and now sitting here as adults. And so again, I want to be very thoughtful and mindful about what your experiences were and what your experiences might have been with context to your the adults in your lives. And it was different. It was difficult because everything was so different. I came when I was 11 and I did not know the language. So things are starting to come to surface, and I appreciate that so much. And we're going to be really tender and thoughtful as we walk through this together. So thank you all for offering your already beautiful courage of sharing in this space. So we're going to continue forward with the psychological impacts of immigration. And if you all continue to share in the chat box, please know I will look in just a moment. Do not hesitate to share. I just want to keep it moving here, but I want to get back to you in just a moment, okay? Let's think about the psychological impacts for a moment. We are going to start with the types of mental health impacts, and then we're going to move into some of the reasons why these arise. And I framed it that way again for us to highlight first, what does one experience in their mind, in their body, in their behaviors, but also why? Because we're not just people who have these outcomes, these challenges. There are reasons as to why. So I'm going to start kind of with the mental health impacts first, and then we're going to have some information as to what can contribute to some of these factors, okay? An immigrant experience could be immersed with with stress. Drop a one in the chat box if you have, especially if you are immigrant identifying or have immigrated at some time in your life, if that experience for you was or has been stressful. A stress is defined as a state of worry or mental tension caused by a difficult situation. What types of stress did you witness as a child, or did you experience as a child yourself with the immigrant experience? Anxiety, sometimes stress and anxiety often get confused. And again, I think that they inform each other. I think we know that. But here, by definition, it's a feeling of fear, dread, or uneasiness that can be a normal reaction to stress. Drop a 2 in the chat box if you have felt as an immigrant any form of anxiety. Again, I often define anxiety as the fear of the unknown. I don't know what's going to happen. I'm afraid. Sometimes anxiety can happen with the present too. I might be showing my mama colors right now, but did anyone watch the movie Inside Out? 2, actually, Inside Out 2. One is good too, but did anyone watch Inside Out 2? Really wonderful movie if you have children, but also even if you don't. Um, really an amazing capture, a visual capture of anxiety and what it looks like and what it feels like. And I thought it was so cool that we're already teaching children how to identify with their emotions. But I think it's also helpful for us as adults, especially if we weren't taught those emotions, and also furthermore how to regulate those emotions. So the anxiety, right, kind of just feeling like you're out of control. There's fear. I have to plan ahead. I don't know what's going to happen. So a lot of control can result from some of the anxiety that's also, again, often caused by the stressors that are actually present. People who have experienced or navigated immigration also have reported different levels of depression. Again, depression is not sadness. Sadness is an emotion that we all experience from time to time, right? We also all experience anxiety, and I think we all experience stress from time to time. But what's important here, especially within the context of the topic, is to identify what were the stressors that were and are most prevalent in my life. How much did the stress of immigration, the anxiety of immigration affect me? What did lead from a great state of sadness to perhaps move towards more depressive symptoms? Some of those symptoms might include helplessness, hopelessness, lack of motivation, high chances of irritability. And usually if it moves into more of a disordered type, it would be a longer term of this. So depressive disorder, for example, would be defined as for longer than 2 weeks, is you can't shake this funk. It's like, I just really am not able to find pockets of hope, pockets of gratitude, pockets of joy. It's just really, really overcome me. Same with anxiety. There are different things that cause anxiety in our day-to-day lives, but if we notice that anxiety is taking over our lives and it's really hard to shake off that feeling that we have in our bodies, in our minds, and it's affecting our behaviors, our relationships, that might move more into various anxiety disorders as well. With depression, you might also find that folks who've experienced immigration, not all, but because the depression can become so great, or the feelings of hopelessness, anxiety, and compounded stressors might lead to suicidal ideation, which essentially means starting to have or moving forward with having ideas of ending one's life. Another psychological impact can include trauma. And by definition, trauma is an emotional response to a distressing event or series of events that can cause lasting harm to a person's physical, mental, and social well being. There are different forms of trauma, and we won't be able to get through all of them today, but one I wanted to highlight is oftentimes immigrants will report, and research shows us that PTSD is a common outcome of the immigration experience. Excuse me, and behavioral condition that can develop after a person experiences or witnesses a traumatic event. Some folks have shared in the past that they experienced perhaps separation from their loved ones. Imagine if I actually have had a few clients who immigrated here without their parents, or their parents came and had to go back, or their parents left and went to a different country and left them with another loved one. And the secure attachment was shaken, and led to not knowing if your parent or caregiver is going to come back, or who's going to take care of you. And that can have great impacts as we get older and then attach otherwise to different people. We know that attachment theory also informs us that there's a great likelihood that if uh, the attachment to a parent or a caregiver at early age is rattled, that there's research that shows that your romantic relationships in the future, should you choose to have one or explore them, can be much more challenging, because the secure attachment at an early age cause one to be anxious or avoidant to get too close to someone emotionally, or can be quite chaotic. So we know that trauma as it relates to immigrants can also show up for a variety of reasons. And again, by definition, attachment is a rupture in the bonding process between a child and their primary caregiver. We also know that in some cases there are outcomes for the immigrant experience of substance use disorders. Essentially, it's an uncontrolled use of a substance despite harmful consequences. Not always, but oftentimes, substance use disorders can lead to addiction of certain substances. In this case, it could be alcohol, tobacco, or other psychoactive substances. Let me pause there, y'all. What's coming up for you? I'm going to go back to the chat box. Are any of these impacts something that you're finding that you have experienced in your life? Are there any that you notice in your clients, again, without naming them, that you notice are something that you work to help them through, that you notice in them that you have questions about? That would be really awesome for you to share. Again, this is a safe and confidential space to share. Yeah, I hear you. I see some emotions surfacing, not being able to connect in school, to be a child. I see some folks struggle with the language. Anybody, especially in your immigrant experience, especially the more, and we'll talk about acculturation in just a moment, feel that there was great stress in having to learn a new language, and then perhaps support your adult loved ones with translation, with navigating new systems that maybe you at a younger age learned quickly and then have served in maybe more of a parentified role. That means that maybe perhaps you were asked to do adult things that maybe you would have otherwise depended on adult for. You were an interpreter. Anxiety because new language and culture. Ooh, I feel that y'all are bringing up emotions in me. I feel this. I feel this with you. I still translate and support. My mom lives in Perth Amboy, so it's little DR. She knows English, but it's still not enough. Yeah, me too. Me too. I still do this with my abuela, with my grandma who's still living. She's in her 90s. Going even to navigate spaces like healthcare are hard enough, and to navigate it, to be an interpreter, to understand how to advocate for one's health and well-being. My mom, she was born here but is Mexican American. She recently in April passed away from cancer. She was on a cancer journey for just about 3 years. And even though she was born here, my mom was actually a therapist too. Shout out to all the therapists in the house. she had a concern. My mom was really good about advocating for herself. She was in healthcare, so she was really good about advocating. Something's wrong. She had uterine cancer. Something's wrong. I'm having some spotting. I'm having some pain in my abdomen. And she advocated, but the immediate response from the doctors or the healthcare team was to have a hysterectomy. And my mom's first response was, I don't want you to just give me a hysterectomy. Um, and I was like, Mom, why? Like, that's what they're advising. And she said, my grandmother, my great grandmother, Rosa, came here to the United States and she had a forced hysterectomy. And we know that women of color, people of color, immigrants often have these very traumatic situations, loss of body autonomy, loss of agency, um, autonomy in all cases, and how that can affect generations, right? Or my mom is a educated, smart, American-born woman, but at the same time, she was not able to, my goodness, trust, right? Trust the healthcare system. And then by the time she finally did decide to say, okay, I will have a hysterectomy, through that operation, they discovered that she had only had cancer, but that it had spread to multiple areas. So we see not only the stress, the anxiety, the different traumas that people experience, it passes from generation to generation, even us here in the United States. So that's all the more reason why we're here, to tend to ourselves, to tend to the people we serve. Thank you all so much for sharing. I see you. Loneliness, lack of social life. Yes, social isolation is a big one we'll get into. Um, yeah, the burnout that can result from this. Wow. Thank you for identifying that too. And remember, everybody, I'm giving you high level research based things here, but your experiences matter and they inform here. So if you tell me, if you tell us, yeah, I've experienced all this and I'm tired and I've been tired and it's catching up to me, and it impacts me and it impacts how I show up with my family, with my kids, with myself, with my friends, or lack thereof. I can't connect emotionally because I haven't really felt like I've been grounded in myself. Maybe because physically I never had a home. I was bouncing, I was migrating with my family. Maybe because when we did, we had different things happen to us. So let's get into that actually. What are the reasons why? You're already doing such a phenomenal, offering such phenomenal insights to us already. There's some research here. And this research I found super fascinating. It is from 2018. This topic of acculturation. An acculturation hypothesis. Essentially, acculturation is when you are an immigrant coming to a new country, in this case, we'll use the United States, there is this pressure, expectation to acculturate, to essentially, I think, morph into what is acceptable to your new home or the new host country, as research uses that word too. And so when we come, there's a lot of pressure again to fit in, to offer gratitude that this country would take you in. And we might see that too if you were a child with your parents, that we got to change your name, we got to help you speak clear English, we have to make sure you get into the schools, we have to make sure that you do all these things that are American. We might have to, again, modify the way that we dress. We might have to modify the way we even move physically. Is anything resonating with y'all as we share that? So really interesting research here. Again, if you have the time, I would encourage you to Google acculturation hypothesis. Super fascinating, especially as we get into some of the reasons why these mental health experiences and challenges occur. But one, just want to really highlight, to acculturate is greatly stressful. It can also be greatly traumatic because when you stop and think about it, essentially you are put in a position of having to choose. Do I honor and preserve my roots, my culture, my language, my appearance, my presence, or do I have to morph into and modify so that I feel emotionally safe, physically safe? I don't rattle too much. I don't stand out too much. I just get in to be able to what? Get the jobs, get the education, get the money, survive oftentimes. But the acculturation hypothesis I found super, super insightful. Essentially, the research says that as immigrants become more assimilated or acculturated into US and social and cultural norms, excuse me, the more their health status resembles that of US born. And the research tells us, and I didn't see too much on this, so I do want to do more digging myself, but it's not a positive thing in the research. There are common risk factors for mental health outcomes that result from the immigrant experience, but it was interesting to see the research that said actually first generation immigrants are healthier in terms of most physical and mental health outcomes than their US born counterparts. So I thought it was really interesting. Like, are we less healthy as Americans? Y'all can tell me what you think. And were immigrants, especially first generation, actually better off in their home countries? And again, that could be for a few reasons as to what you said, right? Is US just kind of filled with these unrealistic expectations of how to move in the world compared to our home countries, compared to the countries that are often seen as not as favorable as Western countries. But one of the things I think is really important to highlight, and I think is something I want to offer as something to really give your power back if you have an immigrant experience, is this concept of an immigrant paradox. We often assume that because you're an immigrant, you have a lower socioeconomic advantage and also a lower health advantage. And that because you don't have access to money or resources, that you would have poorer health. But the research says that's not actually entirely true, that you actually are better off in some ways in terms of health from different countries. But when you come to the United States, there's greater risk factors. And actually, if you come to the United States at a younger age, there are even greater risk factors than if you were a little bit older. And again, that could be because there's a great preservation and truth to self. It could be that that different countries, although they have different challenges we have different challenges all over the world, that the US, as much as it's deemed as this place with great hope and wonderful places, and again, not hating on the US, I just thought it was very interesting that there is a paradox there, that we fight so much in some reasons, and again, some are out of our control. Some people don't want to leave their home countries, but there is a really interesting factor here that we all have to remember, that there are actually some risk factors in coming to the United States and staying here for long periods of time. And again, those might be with the challenges of access to resources for people in general who are born here, but then also otherwise, especially who have immigrated here at an earlier time. So we have to think about that. And again, this is a really high level insight here. I wish I had more time to get through this and even research it more myself. But those stats tell us that first gen are healthier in terms of most physical and mental health outcomes than US counterparts. So that's really the big takeaway here. Again, one more thing here. If you immigrated at a young age or were US born to one or two foreign-born parents, there was research that correlated to having lower health statuses. Again, is that true for everybody? No, research is not that black or white. However, the fact that research in some studies have shown this is an interesting insight for us to think about. And I'm curious, I see some activity in the chat box. I will get to you in just a moment, but I do want to know what's coming up for you. Does any of that resonate with you? Is any of that surprising to you? And then we'll get to more in a moment. So this is really an important slide. Then we'll continue to move forward because I know we want to leave enough time for questions. We mentioned some mental health challenges, the stress, the anxiety, the traumas, etc. Why? What might be a result? Some of you already shared that, right? The language barriers, the loss of connection to your home country, the changes in attachment and so forth. But there are other reasons too. It might be other reasons as to why those health outcomes in that study are showing that coming to the United States or coming to a different country might not always come with positive outcomes either. But also the research, just to not confuse us too much, also says that immigrants are not also expected to just have all terrible experiences either. That's that paradox we want to highlight too, that the immigrant experience doesn't always equal that you're going to suffer. And I think that's really important for us to empower ourselves with, but we are going to move into some reasons as to why they could be challenging. Does that make sense? Okay, thank you. Discrimination. Poor treatment of immigrants. We're living, we've always had, the United States in particular has always had a really interesting tie to immigration. But right now, we're also living in a narrative where immigrants are evil, bringing their worst, are taking jobs, things of that nature. So when that's highlighted, we also see a greater level of hate crimes. We see a greater level of poor treatment. We see racism. We also see different forms of discrimination across religions and the religious or faith or spiritual practices that people bring with them when they come to their host country. We also see economic instability, including housing and employment. Someone said earlier, social isolation. Yeah, it's hard to connect, period. It's even harder to connect when you don't know anyone and when you don't know a language and when you don't know your surroundings. We mentioned attachment, separation from family. There's also, again, with the anxiety, which is also very related to fears, the fear of the legal system, and also fear of deportation for folks who might come undocumented or having some transitional times with their documentation. There's also a lack of the access to resources. So while there are many resources out there, do people know about them? Can they access them? Are they even in regions that are accessible to them? Do people now with this virtual overflow, what do people actually have access to? Phones, Wi-Fi, laptops, etc. So we have to think about not only are resources available, but are people able to access them? Something that really touched me in the research and I want to offer to you all is thinking about the sense of failure. Some people have an American dream or a dream to immigrate to another country. Other times it's, I couldn't make it in my home country. It was really hard. Maybe again, outside factors. And this sense of failure that I couldn't stay in my home, that we had to move to have money. We had to move to have support. We had to leave, or we had to leave because my country was so surrounded with violence or poverty and so forth that we had to leave. Or maybe when people are already acculturating here and recognizing it's so hard to get a job, maintain a job, the sense of failure that can come with that and the outcomes of mental health and the emotional factors, the depression, right? Of this is really tough. And I feel like I'm just hitting a wall. Maybe some of you have felt that way before. Maybe some of your elders have felt that way before. And we also mentioned this factor of violence. Sometimes, again, that trauma of witnessing death or the constant threat of violence or even the anxieties of violence can have a hold of me at any moment. Sorry for that 9 there. That wasn't meant to be there. I'm actually going to take pause here because this is a lot. Oh my goodness. Thank you all for sharing that. Learning a new way of life. Yes. I see someone is a health coach and American diet is terrible. Thank you for bringing in the diet factor. Processed food, where again, in other countries, people don't eat that way. Maybe don't have other resources, but maybe there are some great benefits as well. Home cooked more than eating out. Hispanic people have more support and social life with relatives and friends. Meals are healthier. Yes, the sense of community, where here it's definitely this culture of you're on your own, you win, you path, no one's going to support you but you, right? A very different culture here in the US as well. Racism, lack of basic computer skills, domestic violence because of the stress in the household. Ooh, I want to add that to my slide because that is so true. Domestic violence towards children, domestic violence towards partners, intimate partner violence, sometimes related to the stressors, sometimes related to the substance use or abuse. Yes, absolutely. Okay, let's keep that moving forward as well. So let's check in. I think we're already doing a great job checking in, but again, what reflections are coming up with regards to the psychological impacts resulting from immigration? You all have done a great job with that. Keep those coming. Culturally sensitive support systems. So again, we're going to move into some of the work that we can do for our own selves, but also calling in the folks who are here to serve, who are here to learn more about how to serve effectively, thoughtfully, compassionately. Cultural humility and responsiveness. By definition, culturally responsive care is a philosophy that guides mental health providers towards fully seeing and valuing clients for all aspects of their identity, their background, and their experiences. So I am not afraid to call in your culture, your background, your immigrant experience, your values, your joys, the ways that you socialize, the way that you feel seen and heard. I'm not afraid to call those in as your provider, as your support system. At the same time, we want to practice cultural humility, that even though we are creating this space, we want to know the whole person. We want to make sure that we're responding to seeing you as a whole person and not just what makes us feel comfortable. We also want to recognize that admitting to not having all the answers, just because we're calling it in doesn't mean that I understand or I know everything about your background, about your culture, about your experience, and so forth. But I'm willing to practice my own self evaluation to learn and also to recognize and fix any of the power imbalances, especially if there are any folks who, again, are service providing services to folks like myself as a therapist. People come to folks like us to receive support and help, and there is this embedded sense of authority, especially from immigrant backgrounds or culturally diverse backgrounds, where it's, if I'm taking this step, it's because you're going to help me. And what we want to do is, again, provide the help and support, but also recognize I'm here because I care about you. I'm here because I want you to see you are the expert. You are the driver of your life, and I'm here just to support you. And so we can really exercise that and fix any power imbalances in not only our roles, but also what is our appearance. If you are a man, if you are a white person, if you are a straight person working with the LGBTQ community, if we're looking at any structural systemic power imbalances, to highlight those, to humble ourselves, to know that even though I don't present, or I haven't had the same or similar lived experiences, I am still here for you. I don't know everything, but I want you to be the driver of your life, and I want to be able to support you in that. Does that make sense? Okay. A few ethical considerations when working with immigrant communities. We've highlighted this, but we want to think about the cultural context of what people are coming with and coming from. Some of you can relate because you've already been sharing about your own experiences. Some of you might say family, right? We might not all have the best experiences with our family members, but the essence or the core of family is important and essential to highlight and to honor in many immigrant communities. Also, community is huge. I've already heard that here, right? When we isolate, it might be because we don't know how to connect, or because we came from a place that was so connected and supported, right? It takes a village approach to where is my village? That's really hard. So thinking about, how do we cultivate community for our clients? How do we plug people in with community if they're feeling some social isolation? Religion and spirituality, again, not everybody from immigrant backgrounds practice or prioritize religion or spirituality, but they are present in many people. So we want to make sure that we are highlighting that within the cultural context of cultural resilience practices, as well as our own humilities, and being careful not to assume or also bring in maybe some of the more practiced religions or faith or spiritual practices here from the United States. We also want to highlight from a cultural context, what are the barriers that people experience? We've talked about some already. We're going to get into a few as well, including some social determinants of health. Have y'all heard of these before? Excuse the double of there. Social determinants of health are grouped into 5 domains. So if you are here in this space and we're going to advocate for people, and we'll get into our final slides of advocacy in just a moment, we have to make sure that to have a culturally responsive and humble lens, we have to consider that these experiences don't just come out of nowhere. They're related, especially when we talked about what are the challenges in the United States. We talked about food, we talked about poverty, we talked about language barriers, and so forth. Economic stability is a huge one, right? Thinking about not having, even if you're US born, it's challenging to not have inherited wealth, inherited opportunities, again, speaking languages, gaining skills. Some people come from different countries, and in their home country, they had incredible skills from trades, from education, and they don't transfer to the country that is hosting them. How challenging can that be to start from scratch? And again, that feeling of failure can come back in, that stress, that depression, and so forth. Again, taking on jobs just to making who's going to watch my children when I have multiple jobs, or when I'm not able to fully stabilize myself in this space. Education access and quality, healthcare access and quality. Neighborhood and built environment. Oftentimes we see communities of color, immigrant communities, often in some harsh conditions or harsh regions. And again, that's by design many times. So when we think about that, the type of air we're breathing, the type of access to food, I was just at an event recently that shared about um, the inequities around food distribution, how many communities, especially that face more, that do not have some of the resources at hand, often have more corner stores or liquor stores versus stores that carry fresh foods. So that's why we see greater outcomes of obesity and so forth, and social and community contexts that we've highlighted before. Quick stat here, estimates show that those of the lowest socioeconomic status are up to 3 times more likely to have a mental health condition. So these things are real. There are real embedded foundational things that if we're going to be practicing responsibly, everybody, if we're going to be here in community together of service, of support, we can't just say, oh, it's because you're lazy. Oh, it's because you didn't try hard enough. There are core things of systems, of social systems that can be greatly, greatly compounded and impact one's mental health and ability to thrive. Real quick case study here as we get to closing. Roberto enters a K through 12 school system that is already segregated. This still happens based on race and socioeconomic status as a third grader. The result is a limitation to treatment, a shortened life expectancy, adverse childhood experiences. If you don't know what those are, please Google them. Some of them include neglect, abuse, divorce, various forms of hardship that children can experience. Higher likelihood of a school to prison pipeline. These are, again, these results here are all research based, even from a school lens, from the social determinants as well. They oftentimes, Roberto or kids like him, because they're already funneling into a school system at a young age, especially if you're an immigrant, now you're already funneled into prevented opportunities to build wealth in your own assets, a lack of access to influence policy change, which includes voting or having even the knowledge to know that I have a voice. And so this is really an important case study. Again, is this definitive? No, we see phenomenal outcomes like you all here today. This does not mean that if you're an immigrant, if you're a person of color, that you're going to fail, but our systems are so, so important to recognize as we navigate how we can be already starting from a young age, funneling into the inequities that people can face as well. I'm going to breeze through here because I recognize that we want to leave enough time for Q&A, but real quickly here, one of my favorite teachings I like to offer when I'm doing trainings is an intersectional identities inventory. If you look up intersectionality theory, you'll recognize that we all make up these different systemic identities. And not only do we have them, so for me, I was US born, I'm English speaking, I'm middle class, straight cisgender, and I'm able-bodied based on this diagram here. But on an oppressive side of things, again, not because of my own choices, but because of structural design, I'm also a person of color. I'm Mexican and Iranian. I'm a woman, so I face different systemic oppressions as a result. But not only do we walk around like this with these categories of privilege and oppression, we walk around like this, which makes all of us such complex people. So if we're providing culturally responsive care, it's important for us to recognize, what have my experiences been? What do I present when I'm offering care and service? And also, what are the experiences of my clients or the people I serve? What are some of their privileges that they have? And again, we're not talking about privileges like everyday personality type of things. We're talking about the structural systemic privileges that are inherited by way of the United States structural systems. So this is an important tool that I invite you all to have. Again, you'll have these slides if you want to take more time to look at these. Flying here in just a few minutes, and then we'll get to the questions with hopefully about 5 minutes. We want to think about advocacy, and many of you might be here from a behavioral health lens, talking about mental health and so forth. But even if you're not, you're just here to learn for yourself. Behavioral health is mental health and substance use disorders, life stressors and crises, stress-related physical symptoms. Behavioral care refers to the prevention, diagnosis, and treatment of those conditions. Equity in this sense is everyone, regardless of their race, ethnicity, gender, sexual orientation, income level, geographic location, should have the same opportunities as those who have more access to privilege. And here's a quick diagram that I don't have time to go over, but I think it's an important one to review if you haven't looked at the differences between what's equality versus equity and how do we move towards a place of justice. Really quickly here, again, I'm going to breeze through these. I want to make time. Thank you all. I had such a better time interacting with you all than going through this information, but I know the information is really important, but your stories are important too. So please forgive me for breezing through this final portion here. Essentially, what I want us to highlight is we want to do a service to immigrant communities. And oftentimes we recognize that there are different challenges, and the main challenges highlighted in the research are around cost. So again, NAMI is a wonderful resource to be able to help with access to education, workshops, different resources to help with one's mental health, especially from immigrant backgrounds. So if you belong to NAMI or associate with NAMI outside of this presentation, please continue to provide the resources, share the resources, and also know that there are great things if you are here on your own or working within different agencies, highlighting things like policy, looking at grants that highlight the equities of behavioral health. For me, I work for myself in my private practice, so I offer sliding scale to ensure that I at least have some people on my caseload who are pro bono or at least a lower cost than my normal rates. Accessing things again to make to make things more diverse, like telehealth, and ultimately whole person care and leveraging Medicaid and Medicare. US respondents with mental health needs, particularly Black and Hispanic Americans, were most likely to report cost-related problems accessing healthcare. So that's a huge one. Another big one here in the research tells us about accessibility. We talked about this. I want to highlight things like making this, again, easier to access. Easy directories and resources, things people can understand. I think NAMI is wonderful, and so many organizations out there wonderful in terms of language accessibility. Not everybody has access to the highlighted providers, but paraprofessionals, folks who are in these roles that are there to support are wonderful. Shout out to any paraprofessionals in this space. Transportation, flexible times within your clinics or again, your private practices or the different agencies you work with. We need more behavioral health professionals. We just do. This is a wonderful, wonderful space. It's a hard space, but we need more. So to promote that is important as well. Also highlighting stigma, addressing our own. We can practice team listening sessions and trainings, normalize mental health across your institution. So not only are we serving people with these resources, but how do we normalize that within ourselves as a team or as a staff? Hiring staff representative of demographic and population served, and an emphasis on belonging. We want to, again, conduct intersectional self-examinations, as I showed you in that diagram. Consider cultural interpretations of power and authority we've talked about. Sometimes, especially if you're a therapist or again working, we are often told not to disclose personal information. We don't want to make it about us, but sometimes we want to be able to, again, shift that power dynamic to just humanize ourselves a bit more. So find an appropriate balance of that. Avoid cultural assumptions and stereotypes. Adapt to communication styles, indirect or contextual cues. Again, so much is nonverbal, so being thoughtful about different mannerisms and the ways that we can learn about different cultures. Address and don't avoid racism and discrimination. We want to call in, hey, have there been any experiences here that we want to highlight? So we're not shying away from those. We're inviting our clients to feel safe enough when they feel ready to share about some of their experiences. We want to explore the history of racism in our different ideologies that have taught us. I've been doing a lot of personal work around decolonized psychology frameworks, again, looking those up and leaning into some of the things we learned in school were fantastic. Others were problematic and rooted in racism, having to relearn and unlearn some different things. And again, extending an appreciation for Indigenous science. The last thing I'll highlight here, and we'll get to questions, is I really think it's important for us even just to recognize terminology. We started with that at the beginning. We use words like vulnerable communities, researched communities, but what we want to do, these words first and foremost are evolving. We have words that are progressing over time, the more and more that scholars and people get together and say that word can be offensive, that term can be is not encompassing of what we're trying to say. What we want to do is problematize the power versus the people versus the community. So instead of saying things like minority, we shift it to minoritized. I didn't ask to be a minority. We have been made minorities. So minoritized. The layers of marginalization. So marginalized means that we have been placed on the sidelines to not be able to access what the dominant culture, again, what we saw in that diagram there, oftentimes white, straight, born in the United States, speak the language, have access to higher socioeconomic statuses, etc. So think about the terminology and the ways that we use words. There's great power in that. I'm going to leave you all with this advocacy intervention diagram because it's really important. But the highlight here is that we want to make sure that we use a biopsychosocial cultural model. That's 4 words, that's kind of long, of evaluation and treatment to be able to help us assess for acculturation and the different mental health challenges that can come with that. Cultivate more family and discover more about the community and family connection, the status and the history, people's education or lack thereof, and so forth. We want to make sure ultimately we're building trust with our clients and we're helping them move towards treatment and improve in the treatment so they can live awesome, wonderful lives. I'm going to leave you with this, y'all. Thank you so much. I didn't need to breeze through this so quickly. Actually, what I'm going to do here, I'm going to look at the questions because I know you all have some wonderful questions, but let me just do this. I wanted to leave you all with some empowering words because so much of, again, of the ways that we're navigating the world is something's wrong with you if you're an immigrant. You're not good enough. You're always going to be behind. You're always going to be second class, never like us, never privileged, never right qualified, etc. That's just not true. So I'm going to invite us to close today to get our power back, to empower diverse identities. We want to welcome your stories. We want to reframe negative stereotypes and the outlooks. Also, I want us to, especially if your allies here, to assess for your psychological safety at work or that of our clients. Where do you feel most seen and heard and valued so that you can really get refueled with those things and assist in acknowledging that there's celebration of difference in diversity as well. So y'all, thank you so much. I know that was a bit of a rush towards the end there, and I apologize for that. Patricia, I see you. Can I take, if you want to close this, I can go through these 2 questions that came here. And I don't know if I answered them already, but I can definitely pause here. Thank you all so much.
No problem. Thank you so much for sharing some great, amazing information. I do want to let our participants know and our YouTubers that are going to watch in the future to go to your website because you have amazing articles that that speak on this topic. So thank you so much for sharing. Let's go through the first question just because of time, and then I'll go ahead and close. Do you want to read it or should I?
Sure, I see one. How can the unique stressors of immigration experience impact mental health, and what strategies can help individuals build resilience in a new country? Thank you for that. So calling back in the earlier slides of the different impacts, right? We can see an impact in our behaviors, in the ways the anxiety, the stress, the traumas can show up in our attachment, in the ways that we maneuver, in the ways that our stress and our anxieties can impact our behaviors. Sometimes, again, the social isolation that was highlighted. Sometimes we see, the lack of motivation through that depression or, again, depressive symptoms. But how can we help? This is really why I didn't mean to breeze through so quickly, but this is why I think this enhancing the belonging and enhancing the confidence amongst each other, and especially as people who are providing resources and providing support, we want to empower you. We want you to be able, again, spaces like these are huge, and I hope that they've been healing and restorative even today, to be able to recognize that your stories really matter, that we want to make sure that you feel connected and seen and heard. So whether that's one-on-one therapy, whether that's, we're going to connect with other community resources to make sure that we have holistic wraparound care where we're not only here as your therapist or your your group, we're also connecting you with outside things, people who speak your languages, different community groups, restaurants, places you like to go that help you feel more like home. So I'm gonna pause there. Can I do one more?
One more quickly because we are short on time.
Okay, what role does the cultural identity play in the mental health of immigrants, and how can mental health professionals provide culturally sensitive support? Thank you for that. So I'm not sure if I already covered that, but it's huge. It's a huge role in mental health of immigrants, and it's something, again, that's embedded in us, and with acculturation is often a challenge to figure out how much do we preserve and how much do we have to assimilate to, again, fit in and provide some safety from the context of this country that doesn't always welcome us for our differences. So as providers, again, we want to be vocal and verbal, to be sensitive about the experience, but also to be empowering. So we can find ways to say, yes, we're here and we acculturate as needed, but how can we preserve parts of you? How do we help you feel confident regardless of what the outside world tells you? How do we help preserve some of those things? And you all can inform us, our clients can inform us, right? About the foods, about the language, about the ways people move, about your practices and so forth, so that we know that it doesn't have to be an either or.
Thank you so much for that. Again, thank you so much for your presentation, and thank you to those that are attending today's webinar and for the questions and comments. The chat was vibrant, the chat was amazing. You shared so many insights on our culture and our upbringing, and that really has shaped us to who we are today. It demonstrates that we all have a shared interest, right? A passion for mental health and breaking the stigma within our communities. New Jersey is one of the most diverse states in the country, and NAMI New Jersey's multicultural programs are here to support you. Feel free to check out our website at naminewjersey.org for our resources. I know the link is in the chat. We'll put that in again for those that need it. Before we close our webinar, I would like to remind our participants to complete the survey that you will receive via Zoom, so that we can incorporate your feedback for future webinars. I know time is of the essence, and I know that's maybe one of the feedbacks that we're going to receive today. We would love to have more time with you, Dr. Coleman, but thank you for sharing the hour with us today. And we want to thank everyone who has joined us and shared their time. To conclude this webinar, remember that you are not alone. Happy National Hispanic Heritage Month. Feliz Mes de la Herencia Hispana. Thank you all for being here today, and have a great day.